Hey everyone, and welcome back. If you're a nursing student, you know there are some skills that are just absolutely non-negotiable. Today, we're diving into one of those, inline airway suctioning. This is a game changer for your ventilated patients, so let's get into how to do it right. Okay, so let's set the scene. You've got a patient on a mechanical ventilator. They've got secretions that need to come out, right? But here's the problem. Every time you disconnect them to suction, you're breaking that sterile circuit, which opens the door for infection and messes with their oxygen levels. So what do? Well, the answer is this amazing little device, the inline closed suction system. Think of it as a dedicated, sterile pathway that hooks right into the ventilator circuit. The magic here is that you can suction as many times as you need without ever disconnecting the patient. It's just so much safer and way more efficient. And you might be asking, why is this so important? Well, think about it. Patients on a vent can't cough effectively to clear their own airways. So this procedure, it's literally your way of doing that for them. You're keeping their airway open, making sure oxygen is getting to their lungs, and you are actively preventing really serious stuff like ventilator-associated pneumonia. This isn't just a task, it's a critical intervention.
Okay, so like with pretty much everything in nursing, preparation is key, right? You can't just jump in. So let's kick things off with section 1, getting ready for the procedure.
First things first, let's get our gear. You're going to need the right size inline catheter, and size really matters here. Then, of course, your suction source, canister, and tubing. Grab some 0.9% sodium chloride, we'll need that for rinsing. Your PPE, non-negotiable. Gloves for sure. And your assessment tools, a stethoscope and a pulse oximeter are a must. And always have a bag mask device and an oxygen source nearby, just in case. You gotta be ready for anything. Now, pay close attention to this slide, because this is a detail you absolutely cannot mess up. The suction pressure setting. It's different for adults and kids. For your adult patients, you're aiming for somewhere between 80 and 140 millimeters of mercury. But for your pediatric patients, you gotta be much gentler. We're talking 50 to 100. If you go too high, you could seriously damage their airway. Too low, and you're not gonna get the job done. So always double check this before you start. All right, before you even get to the bedside, let's run through our safety checks. First, dive into that patient's chart. What's their baseline? Any history we need to know about? Then, hand hygiene and PPE on. Next, identify your patient using 2 identifiers. You know the drill. Check for any allergies. And last, but definitely not least, talk to your patient. Even if they're sedated, just explaining what you're about to do can really help calm them down. Okay, we are prepped, we are ready to go. Now for the part you've been waiting for. Let's move on to section 2, the core sectioning steps. First up, get your client positioned. Semi-Fowlers or high Fowlers is perfect. It helps gravity do some of the work. Now, connect your suction tubing to the catheter and, yep, you guessed it, check that pressure one more time. Then, using a clean, aseptic technique, you'll attach the inline catheter to the vent circuit. And here's a super important step. Hyperoxygenate. You'll usually bump them up to 100% O2 for a minute or two. This gives them a little oxygen buffer so their sats don't drop while you're working.
And here's a little pro tip, something you'll see in the textbooks. It's all about timing. If you can, try to insert the catheter right at the end of their inspiration, when their lungs are full of that extra oxygen we just gave them. It's a small trick, but it really does help decrease the risk of their oxygen levels dipping.
Okay, it's go time. Unlock that suction control valve. A little bit of saline helps lubricate the catheter. Now, as the patient breathes in, smoothly advance the catheter. You'll feel a bit of resistance, that's the carina. As soon as you feel it, pull back about 1 centimeter. Perfect. Now squeeze the control to apply suction and start withdrawing the catheter. As you pull it out, give it a gentle little twist. That helps clear secretions from all sides of the airway. And remember this number, write it down, 10 to 15 seconds. That's it. The entire time you're applying suction, from the moment you start pulling back to the moment it's out, should be no more than 10 to 15 seconds. Any longer than that, and you're really risking hypoxia and damage. So be smooth, be efficient, and be quick. So the catheter's out, the pass is done, but you're not finished.
You've got to clean the line. Use that saline to rinse the inner part of the catheter until it's totally clear. This is so important because it gets rid of any gunk that could grow bacteria and makes sure the catheter is clean and ready for the next time you need it.
Awesome job! The airway is clearer, the patient is breathing easier. But our work isn't quite done. Let's move into our final section, aftercare and documentation.
You know, in a perfect world, everything goes smoothly, but we need to be ready for when it doesn't. So what if you see the patient's heart rate suddenly drop? That could be vagal stimulation. You stop suctioning immediately and give them some oxygen. What if the catheter just won't go in? You might have a blockage. And in a worst-case scenario, what if the airway tube gets dislodged? That's an emergency. You grab that bag mask device, start ventilating, and call for help fast. And last, you gotta chart it. You know what they say, if you didn't document it, it didn't happen. So what do you need to write down? The gait and time, of course. Your pre- and post-assessment findings. What do their lungs sound like before and after? What happened to their O2 sat? Describe the amount and color of the secretions. And finally, how did the patient handle it? Make sure to note any complications or extra steps you had to take.
Phew! Okay, so we have walked through the whole thing, from getting your supplies to signing your name in the chart. So let's just wrap this up with a few key things you should take away from all this. Look, you can memorize every step, every pressure setting, every time limit, and that's all super important. But being a great nurse goes beyond the technical skills. So I want you to think about this. While you're performing this pretty invasive procedure, how are you making sure your patient feels safe? How are you protecting their dignity? Answering that question, that's what will make you an amazing nurse. And that is our deep dive into inline suctioning. I really hope this explainer helped clear things up for you. If it did, do me a huge favor and hit that like button, share this with a friend from your clinical group, and definitely subscribe so you don't miss out on our next nursing explainer. Oh, and one more thing. For all of you getting ready to crush your exams, listen up. We've got links down in the description to our summarized NCLEX revision books. They're designed to cut through the fluff and get you exactly what you need to know. Seriously, go check them out. Thanks so much for watching, and I'll catch you in the next